Hello, my name is Belén Erazo and I'm talk about the dental cyst complication. Well, definition. Dental cysts are a type of benign lesion which form round cavities inside the jaw. Its internal part is made up of cells, liquid, air, or a combination of the three. They are normally benign lesions, not tumors, but in some occasions they could give rise to malignant lesions. The dentigerous cyst is potentially capable of becoming an aggressive lesion, producing bone expansion, facial asymmetry, dental displacement, root resorption of adjacent teeth, and pain.
Cystostomy is a possible form of treatment for a cyst. A cyst is a cavity within the tissue, which is enclosed by a small skin or epithelium, which usually is full of fluid or pulp, and which may consist of several chambers. Cystostomy means opening the cyst, whereby the volume of the cyst can be reduced. In the picture, you see a skull x-ray, and in the lower jaw, left, you can also clearly see a swelling, a so-called follicular cyst. The cyst is too large to be removed, as the lower jaw could be broken. The size of the cyst can also be made out from the outside due to the deformed tissue. A cystostomy will first be carried out. A hole will be drilled in the cyst, and a drain, in this case a tube, will be inserted which will communicate with the outside, in this case with the mouth cavity. In this way, the cyst will get smaller and smaller over months. Think of it much like a balloon from which you let the air out bit by bit. When the cyst or the balloon will have reached a certain size, the cystectomy can then take place. Cystectomy is the removal of the cyst. You can find out more about it in the video by the same name. Here we see a picture of the drain. The cyst has already been opened, and in order that the opening doesn't close, a small plastic tube has been inserted. In the picture, it's marked with a red arrow. The black lines you see are stitches, which will be removed after a week or so. The tube will remain in the mouth for quite some time, until the cyst becomes small enough to be completely removed safely along with the tube. Apart from large cysts, cystostomy is also recommended when, for example, important anatomical structures which could be damaged by the removal.
Application in odontology. The type of treatment is conditioned by multiple factors, such as the size of the lesion, its location, its relationship with neighboring anatomical structures, the possible involvement of dental structures, and models. The goal is to choose the treatment modality that carries the lowest possible risk of recurrence and the less morbidity, while at the same time eradicating the lesion. Treatment. Enucleation is the usual treatment for a cyst, which consists of removing a lesion by detection from the bone. As conservative surgical treatment methods enlarge cysts to minimize the size and therefore limit the extent of the surgery, when stabilization and decompression are performed.
Hello friends, this is Dr. Rohan Virani, and like every time I have come up with one very interesting video on dental cysts. Now what exactly is this cyst? Cysts are nothing but long-standing chronic infections in the mouth. So when there's an infection in the mouth which is probably left unattended for very long, they form a small cavity in the mouth, eroding the bone, dissolving the bone, and later on, after many years, the patients come to know suddenly I'm having the pain, suddenly I'm having the swelling in the mouth. This could be anywhere in the mouth. It could be in the lower jaw, it could be around your nose, it can be at the back side of your cheeks. So I want to show you this live video of how we can treat the cyst. Now, as you have seen on my screen, there is nothing to worry when there is a cyst. What we do typically is we examine, like in this case which I am sharing, This lady which is there, she was having some pain and swelling in this lower jaw area. So we examined her by doing the OPG X-ray. As you are seeing on the OPG X-ray, there is a big lesion developing from her canine to the premolar. Obviously, it has to be removed. Now, this removal, we plan it under local anesthesia. What we do is, after nicely anesthetizing the patient, the cyst has to be enucleated. It's a very delicate procedure where we open up the gums like what you're seeing on my screen right now, and we delicately start removing, excising all the tissue, all the infected mass. This procedure has to be done very nicely and accurately because there are a lot of nerves. For example, here, this is the inferior alveolar nerve, or there could be some important anatomical structure which should not get destroyed or cut during the process. So once the cyst is nicely enucleated, immediately we remove the lesion and put it and fix it in formalin so that we can send it to the histopathology for doing the biopsy and studying exactly what that infection is. After the work is done, this patient is nicely sutured up as you are seeing on my screen, and this will help you take care of the cyst.
Pros and cons. Pros. Have extensive knowledge about the diagnosis and treatment of dental cysts to avoid future complications. Carrying out radiographic and histopathological studies. Know how to identify the maxillary cyst most likely to transfer by differentiation of the epithelium into benign and or malignant tumors. Cons. In the lower jaw, as a consequence of adventitious cysts in the molar area, and almost total resorption of the ascending branch can occur with the displacement of the molar. In the upper jaw, it can invade the maxillary sinus and produce sinusitis. It can also progress towards the nasal passage and the pteriomaxillary fossa, causing pain and infection, sometimes producing suppuration and fistulas to the ossa. The most serious complications will be the formation of an ameloblastoma and formation and development of an epidermoid carcinoma. Is suable in Ecuador. In Ecuador, within the impact of the maxillofacial level, changes were found at the level of the bone structure, alteration of the maxillary sinus and nasal alteration. It is of great importance to mention that more than half of the cause present alteration to the adjacent face due to the presence cyst. The cyst has a variant of considerable cyst that this increases with age. The older the cyst is the larger the cyst, and the larger the cyst more affects adjacent structures. In the dental cyst, according to its age of appearance, different changes will be seen at the radiographic level both in size, in location and in compromise of structures at the maxillofacial level. Finally, conclusion. The maxillary bones are the seat of a wide variety of cysts and neoplasms that can be difficult to the diagnose. Of all the tumor processes that occur in the maxillofacial territory, cysts are of great importance due to the frequency of their presentation. All cysts have a different origin and clinical behavior. Their growth is always slow and expensive. They are generally asymptomatic and discovered in routine radiological examinations. They can, due to their expansion, cause bone fractures and are recurrent. The present diagnosis, the size of the lesion, and its relationship with neighboring anatomical structures will determine the type of treatment to be chosen.